Image of I'll discuss the OBG Recall of 2025, the second part. The laparoscopy. This is they have given a laparoscopy image of patient with infertility. There will be a delayed cycle with free spillage of the in the chromoperturbations. You can see there is a two ovary with bulky ovaries with multiple small follicles in large ovary. There is no spillage, there is no endometrial lesion, so there will be no fibroid in the uterus, there is no endometriosis. Basically, this is the bulky uterus with a large ovary with increased volume. This is a PCOS case. The next question is a 50-year-old female patient present in an ovarian mass with an ascites and omental caking. You can see omental caking. These are the things: ascites, omental caking. These are the things. Ovarian mass with ascites, omental caking. Ultrasound will be a solid component. CO1 will be 990. So basically, all this. This is the age group, 50 years with omental cakings with the CO1 990. All are towards the serous carcinoma. There are also given mucinous, adenocarcinoma, serous adenoma, endometrial granulosa cell carcinoma. The most probable diagnosis is serous because the age group is 50 and the ovarian mass with caking, omental caking usually in the serous type. That is the most common type, and CO1 is 990. Okay, this is the answers is serous. That is B. The next question, which is the following statement, they have given a cord external body image of histopathology. So basically, it is usually seen in sex cord stromal tumors. This is correct statement, and even will be increased, but CO1 will be usually not increased. Cord external body, and answer is 1, 2, 4. This is the answers. Okay. So CO1 will be usually not increased in the granulosa cells tumors or sex cord stromal tumors. These are the basically the sex cord stromal tumors is the cord external body, and even will increase. So what is the role of magnesium sulfate uses all except you can see this is used in neuroprotections in the preterm labors, like preterm labor you have to give Maxel loading dose 4 gram IV, then you have to transfuse 1 gram per hours for 24 hours for the neuroprotection dose. Then prevention of seizure prophylaxis you can give in the preterm pre-eclampsia. In the eclampsia patients you can give with the pre-chart script for the prevention and the treatment. Also for the prevention you can give the loading dose 4 gram, then IV followed by the tape 10 gram, the IM 5 gram each IM in the buttocks. That is the loading dose of the pre-chart regimen in the pre-eclampsia, prevention of seizures, and so on the treatment of seizure. And it has a membrane stabilizer property, but it has a excretions in the renal through kidney, but it doesn't increase the renal perfusion. So you have to, so when you are giving Maxel, so you have to check for the urine output because it will be excreted through the kidney, but it is not increase the renal perfusion. So answer will be A. The next question is the asymptomatic 29 years pregnant woman present with the first trimester with urine culture showing E. coli. So basically the most common complication associated with this they have asked, if there will be a history of preterm pre-labor rupture of membrane, then that will be a chronic ARM, the chronic leaking, that chances of chorea immunity is high, and neonatal mortality it will not cause that much E. coli urine cultures. And basically the urine culture asymptomatic or significant bacterial is caused significant preterm labor. So basically this is the answers. Fetal death usually not caused by the UTI. The next question, which is the following not seen in the Turner syndrome. Turner syndrome you see webbed neck is there. In the Turner syndrome there will be short fourth metacarpal widely spaced nipple, but there will be not a flat occipital there, not prominent. Okay. The next question is the HPV strain most commonly associated with the CS cervix. You can know, everybody is know the high risk HR HBV, that is your 16 and 18, that will cause all this type of squamous cell papilloma, squamous cell carcinoma of cervix and vagina, and rectal cancer. 61 is the low risk type, that will not cause that much. There is the 31, 32 using in the Gardasil 9 vaccines. Okay. The next question is the most teratogenic drugs causing neural tube defects. Usually you can know the lamotrigine, no. This is the valproate, is the sodium valproate, the most teratogenic drugs that will cause neural tube defects. Aneuploidy, aneuploidy is the number of chromosome. It will be a trisomy or it can be a extra chromosome added. This is the 47 XXY. There will be a extra chromosome added. This is the aneuploidy or euploidy. Aneuploidy means any one chromosome defects. So Bloom syndrome, it is due to the mutation of a single gene. This is not a aneuploidy, single gene disorders. So answer will be Bloom syndrome. The next question is the arranged in correct sequence of the steps of pap smear. So basically when you are doing pap smear, you should not contaminate your cervix. So during the pap smear should not contaminate, like should not be anything, so any vaginal pessary, any dosing. So there will be no touching of the cervix. Without touching the cervix with your fingers, so before going to do pap smear, you should not do PV first. So the step is you do the patient lithotripsy position, then you will speculum examination, then directly take the sample without doing PV. So after that, after taking the sample, you can do PV. So basically this is the without, don't contaminate the cervical part. So next question is the timing of insertion of the IUD for good acceptance. The immediate postpartum, that is your PPO ICD, you can put immediately after the delivery, and the within 40 days, that is the postpartum ICD, that is the post delivery, postpartum post delivery. So early postpartum or post delivery you can put, or within 5-7 days of the post menstrual phase you can add it. You can put post menstrual, but during the within 7 days of next menstrual cycle, that is the pre-menstrual play, you should not put. So answer will be A, and A, B, C is the correct options answers. The next question is which is contraindicated in pregnancy. Basically everybody knows CT scan is a high ionizing radiation, so it is usually contraindicated. Doctor, you can use the MRI ultrasound is very safe in pregnancy, so that is not a contraindication. Thank you. If you like this, please like and share. Thank you all. Please subscribe.